Chapter 2 discusses the approval process. Approval of new drugs by the U.S. Food and Drug Administration, or FDA, has been steady since the early 2000s. The FDA Center for Drug Evaluation and Research has averaged 23 approvals per year. The combination of drug discovery and manufacturing takes about 12 to 20 years, which is a cost of more than $1 billion. Only a small percentage of drugs are approved, and the steps are indicated here in this illustration. If you pay attention to the drug discovery and development, it takes about 2 to 10 years in order for this process to take place. The preclinical research and development takes another 3 to 6 years, as well as the different clinical trials, 6 to 7 years. The FDA then has to review it, which takes another 1 to 2 years. And then the manufacturing of the drug has to take place because the drug has to appear on the market, and there might be follow-up studies and inspections that take place. So a series of extensive years in order for this approval process takes place whenever we're thinking of allowing a new medication to be developed on the market. The set of drug standards used in the United States is the United States Pharmacopoeia of 1820. The United States Pharmacopoeia National Formulary, the current 3-volume authoritative source of drug standards, is an annual publication with 2 supplements. Experts in nursing, pharmacology, pharmaceutics, chemistry, and microbiology all contribute to the publication. Drugs that meet these standards have the initials USP following the official name, denoting global recognition of high quality. The International Pharmacopoeia, first published in 1951 by the World Health Organization, provides the basis for standards in strength and composition of drugs for use throughout the world. The book is published in English, Spanish, and French. The 4th edition, volumes 1 and 2, was published in 2006, with the first supplement in 2008. If we're to think of how drugs are being legislated in the country, through federal legislation, the public is being protected from drugs that are impure, toxic, ineffective, or not tested before public sale. The primary purpose of the legislation is to ensure safety. America's first law to regulate drugs was the Federal Pure Food and Drug Act of 1906, which did not include drug effectiveness and drug safety. Please refer to this text to look at 1938 Food, Drug, and Cosmetic Act, 1952 Durham-Humphrey Amendment to the 1930 Act, and for a little bit of history, the Cooper-Harris Amendment to the 1938 Act. Over time, you can see how legislation has played a significant role in the medication administration or pharmaceutical world. Controlled Substance Act in 1917, the regulation and reform in 1978. HIPAA was established in 2003, which will control what we can and cannot disclose, patients' rights. 2003, pediatric research, and Medicare prescription drug was improved and modernized in 2003 as well. In 2007, the Food and Drug Administration amendments developed another act. 2009, regulation of smoking and tobacco use. And currently, what's hot on the press is Patient Protection and the Affordable Care Act, which essentially the components are to include equality, affordable health care for all Americans, improve quality and effectiveness of healthcare, prevention of chronic disease, and improved public health, improved access to innovative medical therapies, and community living sources and services and support in the United States. So this has played a huge role in regards to our legislation in our country at this time. What is unique to nursing is the Nurse Practice Act. Every state has its own laws regulating drug administration by nurses. Generally, nurses cannot prescribe or administer drugs without a healthcare provider's order. Practicing nurses should be knowledgeable about the Nurse Practice Act in the state where they are licensed. Nurses are responsible for knowing their state's law and administrative code. It's very simple to obtain a copy of your Nurse Practice Act. It's available online. So if I were you, it's always important for you to have that information easily accessible so that you are able to understand what your scope of practice is. Nurses who administer a drug without a licensed healthcare provider's order are in violation of the Nurse Practice Act and can have their license revoked. So it's very important for us to understand how we are to function and how we are to stay within our scope of practice. In civil court, the nurse can be prosecuted for giving the wrong drug or dosage to a patient, omitting a drug dose, or giving the drug by the wrong route. I know sometimes we can become very task-driven whenever we are caring for our patients, but it's essential for you to understand the importance of this very thing that we do. Medication administration is one of the largest things that we do, but at the same time can cause us to lose our license. So it's important for us to understand it is the biggest responsibility that we have as nurses. The legal terms to these offenses are as follows: misfeasance, negligence, giving the wrong drug or drug dose that results in the patient's death; nonfeasance, omission, omitting a drug dose that results in the patient's death; malfeasance, giving the correct drug but the wrong route that results in the patient's death. If you're thinking of drug regulations in Canada, the Health Protection Branch, Department of National Health and Welfare, is responsible for the administration of the two acts that are the foundation of national drug laws. The manufacturers, distribution, and sale of drugs, except narcotics, are controlled by the Canadian Food and Drug Act, which was amended in 1953. The manufacture, distribution, and sale of narcotic drugs are controlled by the 1996 Controlled Drugs and Substance Act. Like the U.S. Controlled Substance Act, the Canadian Act requires prescriptions and strict record keeping for all narcotics. Please refer to your text in page 17 and 18 for you to be familiar with the Canadian drug regulation. An even more scarier concept is counterfeiting. Counterfeiting of medications and adulterated prescriptions is on the rise. Contributing reasons for this report of counterfeiting incidents is not mandatory, and that counterfeiting has features of a perfect crime. The FDA and consumer groups are working on strategies to combat this problem, including tougher oversight of distributors, a rapid alert system, and a better informed consumer. So the role of a nurse is to make sure that we educate the consumer. The nurse must advise the patient to report any difference in taste, appearance of a drug, or in packaging of the medication itself. Patients should be alert to any slight variation in the packaging or labeling, should note any unspecified side effects or unexpected side effects, should buy drugs from reputable sources. Reputable online pharmacies have the designation of verified internet pharmacy sites and display an approval seal. If any suspicion of this counterfeit arises, patients and families or nurse should contact the FDA immediately. Drugs have several names. The chemical name describes the drug's chemical structure. It will be the name that is normally revealed in the chemical structure of a medication, which was seen in your organic chem class. The generic name is the official non-proprietary name for the drug. This name is not owned by any drug company and is universally accepted. Most drugs are ordered by generic name. The brand trade name, also known as the proprietary name, is chosen by the drug company and is usually a registered trademark owned by the specific company. Drug companies market a compound using its brand name. For example, Narcan is the brand proprietary name of the drug whose generic name is naloxone. Please refer to these drug resources if you ever need to look up any formularies for any drug information for medications that you may be administering to your patients.